What do you want to talk about?
I don't know. I thought I'd go to first shots.
Okay.
Does that
do
sound like fun?
Yeah. First shots. So nursing school.
Yes.
Learning how to give shots.
Yes. So
Did you use oranges?
we shot up oranges until they almost exploded, or they were leaking fluid. They would get really, really big, and then they would just ooze water out of them. So we just used tap water, filled a syringe, and then would practice darting the needle fast. You want to get through the skin fast. It's amazing how soft an orange is. And it's amazing how soft the skin is. You know, when you're a kid, you think that skin is pretty tough because it holds in all of our blood and guts, right? So yes, we dart and then fill up the orange. And then once you get good enough, you have to practice on each other. So this is after 2 years of chemistry and physics and biochemistry and statistics and all the classes. Bowling, I even took bowling as a prerequisite. So a real important job. Good to have bowling when you're going to deliver babies. Comes hurling through there, strong hands to hold on to them. Anyway, the bowler. So we practice on each other, and we practice IVs on each other, and we practice there's a simulated hospital room in the College of Nursing that has a bed in it. So we practice making beds without a patient in it. And then you have to make a bed with one of your nursing peers laying in the bed. And then we have to pass NG tubes.
Oh, nasopharyngeal. We did those in the Army.
Did you?
Yeah. Yeah. They're important to help with breathing if somebody's wounded in combat.
Oh, that's an endotracheal tube. So that's a tube into the throat, or you can put it in the nose too.
We put nose ones.
Yeah, we use in the hospital, you put it in deep throat, in the mouth. But an NG tube goes into the nose and down into the stomach. You've got to be careful when you get into the deeper throat. There's two openings. There's the esophagus and there's the trachea. The trachea goes to the lungs and the esophagus goes to the stomach. So you don't want to get that tube into the lungs. You've got to get it into the stomach. So you pass it, and patients gag. And it was my turn. So you pass it on a dummy first. And then once you get it into the dummy stomach, then you can pass an NG tube on your friend. So you hold an emesis basin while the friend is passing this tube in your nose, and you gag and you vomit and your eyes water. And then once they get it into the right spot, they have to prove that they're in the right spot by aspirating stomach fluid. If there's any left after you vomit, aspirate stomach fluid, and then they pull it out. And I screamed when mine came out. It just hurt so much, and it was a brutal thing. We had to practice mouth-to-mouth resuscitation on each other. So we put a cert if we were the victim, we had to lay on the floor like a real victim, and then they'd put saran wrap over our mouth and punch a hole through it. And then my peer, whoever it was, and it was Lois when I was a student, Lois breathed for me. I just have to stop breathing. And she comes in and goes, she would, put her mouth around my mouth and she would breathe for me. And she had to breathe for me for 15 minutes.
Jeez.
And then you have to breathe for her. So all of us were paired up to do those. Interesting. We had two people that were married in our class, one man and one woman, and those two always got paired. And they weren't married to each other. But anyway.
Oh, really?
So we did this mouth-to-mouth resuscitation. The thing that I learned about that, or doing that, it's not so easy to breathe for someone. It's not hard, but it's hard to get started.
Yeah.
Especially if they're giggly. We kind of got the giggles and had to settle down, and you just have to kind of close your eyes and pretend like you're not there. But breathing is hard work. You don't realize how hard breathing is until you don't have to breathe anymore. You can just lay there and it's amazing not to have to breathe for yourself. Anyway, so I get into the hospital. I'm really good at shots, I think. And my goal is to give really, really good shots.
When you're still a nursing student?
When I'm still in nursing school. So I've just barely passed the orange test.
Yeah.
And I go to the hospital, and it's my job, out of all the nursing students who are in the hospital that day, it's my job to give all the medications on this one floor. And it's a surgical floor. All the patients had surgery the day before or 3 days before. And they weren't the days where we had pain medicine where patients could push a machine and just get a measured dose. We had to give them shots every 3 to 4 hours for their. I wish I had invented those pain machines, those PCAs, which is a patient-controlled device. Anyway, I'm get up really early. I'm nervous. I'm excited. I'm terrified of shots myself. My peers have given me shots, in my arms as practice. Yeah. And I've given shots to them, but I hate them. I really as a child, when I was a little tiny girl, leaning over not even a tiny girl, when I was in high school and getting strep throat when I lived in Cheyenne, I'd have to lean over my mom's lap. She'd sit down. I'd lean over on her lap. Even as a grown-up, my feet would touch the floor and my head would be on the floor on the other side of her. And the nurse would give me a shot of penicillin in my butt for strep. And penicillin is like giving a shot of Elmer's glue. It's very, very thick. It goes in very slowly. And the bigger the needle, the faster you can inject it. The slower the needle, it takes a long time. But it's probably less painful, honestly, to give it in a slower needle than in a big needle because anyway. But I wasn't giving penicillin.
You don't do shots well.
I didn't. You mean I didn't receive
them well.
I'm really, really a baby. So I go and I study. I get up early in the morning. I'm going to give shots. I study all the medications that I'm going to be giving that day, the Demerol, the morphine, and then the insulin and whatever else was prescribed to the patients. I'd been to the hospital the night before and looked at all the medications and written them down and come home and studied. Got up early, restudied again, give the right dose to the right patient at the right time, and then all the 5 ways to give medicine. So I get a call for the first pain shot. I put my draw up the medication, put it on a little tray. My instructor's standing over me. She's watching very, very carefully. I've done it all correctly. I march into the patient's room, and this lady, she's laying on her side. And I'm going to give this shot in her hip because it's a big pain shot. It's a Demerol. And so she's laying on her side, and I think that's great. I'll just, I walk over in front of her and I introduce myself and tell her I'm the student nurse today. And I say, nice to meet you too, Mrs. Sherry. So I'm going to come around and I wipe her little hip. I'm going to give it in her hip, wipe her hip with a little alcohol sponge. And then I open up my hand like this because this is how you frame your injection site. You give it right here. And so I frame the site on her hip. I put my hand on her hip and frame the hip, and I plunge the needle into her hip and give the medication. And after it's done, I say, oh, Mrs. Sherry, that's the first shot I've ever given to a patient. How did that, I hope it didn't hurt. She goes, well, you're right there. It didn't hurt. I said, oh, I'm so glad. Because I practiced, I didn't want that to hurt. And she said, well, it didn't hurt because I'm paralyzed from the waist down.
Oh my.
I said, oh, I'm so sorry. She said, oh, it's okay. It happened a long time ago. I gather up my stuff, practically run out of the room. And my instructor catches up with me and she said, Susan, why didn't you know that patient was paralyzed? And I said, I didn't study the patients. I'm not taking care of her. And she said, are you not taking care of her? And I said, oh, I guess I am. So she said, yes, I'd like you to go to all the records, go to the Cardex, we called it in those days, and you review all the patients. So you're familiar with what their situation is and what their other situations are with their family, with their health. Okay. So the next shot, I give an insulin shot, I give a couple pain pills, and then I get called to go into another room. And I walk again, I've got my instructor and draw up the morphine this time in this little syringe. And I walk into the patient's room and introduce myself. And I help him get to his side. I plunge the needle into his hip. All of a sudden, the plunger out of the center of the syringe. I don't even know how to get.
Okay.
And I hit, evidently, a large vessel. But I put the needle in, and all of a sudden, the syringe, the inside of the syringe, the plunger where I'm supposed to shoot in the machine, just bursts out of the syringe. And it comes out so fast, it's just squirting blood, just pulsing onto this curtain behind me. My instructor reaches over suddenly and just pulls the needle out and just throws pressure, really hard pressure on that guy's hip.
Yeah.
And I am just shocked. And she comes around to the patient, kind of holding her hand on her hip, says, we hit a blood vessel. So we weren't able to give your medication to you, but we'll go get it. But first I have to get a pressure dressing on your hip so it doesn't bleed. And so I run out and get a big dressing tray, bring it in, and she slaps like 2 big ABDs. They're like peri pads, 2 big peri pads on her hip, on this guy's hip, and wraps it up with really heavy tape, like duct tape, but it's white hospital tape, adhesive tape. And then she says, we're going to go out and get the medication, and we'll be right back in and give you the shot that you so badly need. And he's run out. I drop the medication again. She tells me, by the way, you did everything right. She said, I in my life have never seen that before. And she said, I probably, and you, even in your life as a career, will never see that happen again. Wow. She said that was a blood vessel that wasn't in the place where we expected a blood vessel to be.
Wow.
That isn't the normal route of a blood vessel in the hip, through the hip.
Wow.
So she said, I don't know what happened there, but lesson learned, just get the needle out or get whatever it is that's causing the hemorrhage out as fast as you can. So we march into the room. I go into the room, and this guy is still laying on his side. He hasn't moved. And I come around to talk to him, and he said, could I talk to your instructor? And I said, sure. So my instructor comes into his vision. Could you give the shot to me, ma'am, instead of her? And my instructor said, sure, I'll be glad to. And so she does successfully. He turns on his back then, and she gives it in the upper outer quadrant on the buttocks on the other side. And hopefully, she doesn't hit any blood vessels, and it all goes very well. Now, the third shot, when I round the day before, when I'm looking at all the patients I'm going to be taking care of, I see one of them. I'd been to a football game on Friday night for my college, and I was so excited to see this very famous guy who played football. He was the quarterback, and he was just amazing. But in this game, he was injured, and everybody hooped and hollered and clapped as he was carried off the field. I didn't hear anything else about him, but on Monday, on Sunday night, when I go to look at the records, he's had knee surgery. He's scheduled for knee surgery on Monday morning, and I'm in the hospital on Tuesday. So I know I'm going to be giving shots to my hero. So I'm kind of prepared, like, what am I going to say to him when I meet him? And I'm going to walk into this room. And so I've got the shot ready. I go into his room and I say, hi, I go to the same university. I'm a nursing student there. And boy, I sure hope our team does well with you out of the game for the next few weeks. And he said, not a chance. He's a cocky dude. Well, I've got a shot to give you. And he said, okay. And so he turns on his side, and I get ready to give him his shot. I'm going to end the story right there, but it didn't go well. After that shot, I come out of the room. I am bawling. I run into the bathroom. That's the only private place. Go into a stall and just sob my eyes out. I am just so sad and so upset. And I think I put 2 years into nursing, and I really wanted to be a nurse very badly. It was a mistake on my part, and a pretty serious one. So I'm going to let you go there. And my instructor came in, and she did say what happened, and I explained to her what was going through my mind and how I was distracted by him and all the excuses I could think of. And she said, you need a lot more practice. You have to practice until this is an automatic process for you. You have to be able to go into a room, no matter who you're giving a shot to, have it be done correctly. And she said, so I'm going to assign you to 3 more weeks of giving all the medications on the floor. And she said, and you better practice, because it has to be done as best as possible. It has to be done perfectly. I said, okay. Yeah.
When you took that long pause between, you were at home with us, when you started working again, did you have flashbacks to nursing school thinking I might not be able to do this?
Oh, yeah.
Yeah.
People told me, so I wasn't afraid to give shots anymore. I'd given a million shots.
Yeah.
And I probably had that conquered before I was out of nursing school. But yes, because there was 7 years in between nurse and being at home. And I was very, very nervous. But the first story in my book is coming in as a brand new orientee and finding that the nurse that was teaching me
Yeah.
Really lacked some really critical communication skills that I had learned through the years. She was much younger than me, but she had worked as a nurse for a few years in OB, which I hadn't done. So she was orienting me to OB. And I realized that first night that it was like putting on a pair of old shoes. And I've told many nurses since then, don't worry, take out time and live your life and be a mom or do whatever you need to do. But when you come back, if you ever come back, it's not that hard. It's a good thing to do. And there's ways to catch up and get up.
When you were a manager, did you find that you had a hard time hiring women who had that break, or was it something you could relate to? Do you think it made you a little more empathetic to women who might have chosen to stay home when their kids were little and go back to work?
Gosh, I've never thought about that, but you learn so much doing other things, like even hike like a woman. If a woman takes time off just to spend time on herself, you gain so many other skills. Yeah. So I found that those people that were, they're excellent nurses right out of school. There's excellent nurses in all walks of life.
Yeah.
It really is about how you communicate with patients and how you communicate with peers, and how it's really a communication, how serious you are. Good question, though. I don't think I think definitely I related to nurses that came back and had children. Definitely. It wasn't an automatic, no way, I'm not going to hire you. Maybe it was for other managers. I don't know. Sometimes for me, it was about who they were.
I don't know. I think what I want to show people is that, that story brought up a lot of, you can take a break.
Yes.
You can take a break and still come back, and maybe even come back better than you were before.
Absolutely. So there's burnout in nursing, really big time. And burnout nurses that keep on working.
Yeah.
They either get invited to go to another position, or they really burn out and never come back because they're just so exhausted.
Yeah.
It's almost too much.
Yeah.
I think we all go through stages in our lives where we need a break. And that's why vacations are really important, that we take those times to feed ourselves and go for a hike, go for a walk, do something every day if we can.